I mean, it's nice to see a few of you here. Appreciate your showing up. My name is Tim Tenkate, and I'm from the Business Development Office at Bronson. We have Dr. Robert Baker, who will be speaking, and Heather Showquist, who will be speaking. Dr. Baker is one of our family practice sports medicine providers in the orthopedic and sports medicine program, and Heather is one of our licensed athletic trainers who does both visitation, and she supervises some of the graduate assistant ATs out there. Both are very versed and experienced in dealing with the concussions, which is why you're all here. So I guess at this point, Dr. Baker, I think you're starting?
Sure.
Okay.
Sounds good. Very good. Once again, I want to thank you for coming out tonight and hopefully picking up some information on concussion. I'm going to talk about what a concussion is, and then Heather's going to finish it up with, once the concussion is diagnosed, what's kind of the return to play, what's the management of the concussion. As you can see, I serve as team physician for Western Michigan University, and I actually work with the hockey team there as well. And I was thinking on the way over here, this was my one opportunity. We won the CCHA last year, and I was fortunate enough to also be included. I got a ring for that, and I was going to show off my ring, and I forgot it tonight. But anyways, I deal with concussion sort of on a day-to-day basis with our athletes over there in hockey in particular. And I can tell you we've had folks that have had several concussions and folks that we had to disqualify for concussion. So I'm going to talk tonight a little bit about what a concussion is, some general knowledge regarding the concussion, what we know, talk about some myths, and hopefully correct some of those myths for you in your mind. And then at the end, you'll have an opportunity to ask some questions, either of myself or Heather. Concussion is caused by a bump or a blow to the head or to the body. Doesn't necessarily have to be a head-on head hit. It could be just simply from checking the body into the boards. Causes the brain to move rapidly inside the skull, and then that results in some damage to the brain, some injury to the brain that's manifested by behavior changes, problems with thinking, and problems with physical functioning. Concussions can occur without a loss of consciousness, so that's an important thing to keep in mind. They don't necessarily have to be knocked out. This is a little schematic of how the concussion occurs, and it talks about getting hit head on head and where those forces are delivered at. And I actually brought a little something tonight as an illustration of this. You know, you can look at the PowerPoint slides and things of that nature. I borrowed my wife's pumpkin bowl here and put a little orange in it. The bowl itself represents the skull. The orange inside represents the brain, and the brain sits in some fluid here we call cerebrospinal fluid. So the brain is actually floating within the skull itself, which is a good arrangement because slow movements, you can see the orange kind of stays in one place. But if you have a significant amount of trauma, either to the body or to the head, so you're skating along here and all of a sudden somebody hits into you, you have a rapid stop, what's going to happen? Orange sloshes against the inside of the skull on one side, and then you can see it sloshes back and hits the other side. So you can have damage on one side, but you can also have damage on the other side of the brain. The thing that's not represented by this, though, is there's also a brain stem down here. So the brain is connected through the skull itself. So it's connected on that stem. Also, if you get a rotation component here, you get some twisting, turning of that orange, and you can get further tearing of of some of the nerves of the brain. And that's what we think ends up causing some of those changes in behavior, changes in functioning, changes in thinking. Okay, and I think these slides are going to kind of flip through, unfortunately. But concussion can occur in any sport. All concussions are considered serious. And then repeat concussions can result in brain swelling, permanent damage, and death. And that's the part that we really want to try to prevent. We do know a couple of things in terms of when concussions occur, and the fact that if folks go back too soon from a concussion, they return too early, the brain's still healing, you can have a greater risk of brain swelling, permanent brain damage, and even death. And I think Heather's going to talk a little bit about that. Second impact syndrome is what we try to prevent. Signs and symptoms. Lots of different non-specific type signs, but some things that can be observed by a coach, some things observed by an athlete. So appears dazed, stunned, confused about assignment position, forgets instructions, unsure of game or score of opponents, moves clumsily, answers questions slowly. On the athlete side, they complain of headaches, pressure in the head, headaches, pressure in the head, nausea or vomiting, balance problems, and dizziness. And by the way, balance problems and dizziness probably are an ominous sign in concussion. When we see those presenting, oftentimes those are concussions that are going to take a while to resolve. Sensitivity to light is a common complaint of this, related to concussion as well, and then sensitivity to noise as well. Other symptoms that may be observed by the coach, losing consciousness, even for a brief period of time, sort of indicates that there's a more serious type injury, but it can also be without loss of consciousness. You can have a fairly serious type head injury. Shows mood or behavior changes, personality. They're not just acting like they usually are. Can't recall events prior to the hit or after the hit. So amnesia is what we're talking about there. Feeling sluggish, hazy, concentration or memory problems, confusion, and then just doesn't feel right. And doesn't feel right is another predictor of a long recovery or long period of overcoming the concussion. If you look at high school sports, and they did a study that compares risk, controlling for the number of athletes, number of exposures, so per 1,000 AE athlete exposures to kind of keep everything on the same level. Here we see that football tends to be the highest risk, and then hockey behind that. And you can see other contact sports like soccer, men's and women's, wrestling, and even cheerleading can happen in any sport. Hockey related in the juniors, when they look at per 1,000 player games, expect about 6 concussions. So in general, I tell most folks during the course of a season, you probably can expect anywhere from 3 to 6 concussions on folks from your team. All right, predictors of severity, being knocked out more than a minute, time or memory loss, so amnesia, loss of memories, loss of time, can also be a predictor of a more severe concussion. Number of symptoms, so the more symptoms they have, for example, if they have not only the dizziness, but behavior changes, they may have anxiety, depression, feel anxious, feel depressed, difficulty sleeping. Those are all, the more number of symptoms that they have, the greater the severity. Recent or frequent concussions that occur recurrently, and then any concussion that happens with a lot less force. So if concussions are happening seemingly more easily, those are ominous signs, and those are times when we talk to the athlete about maybe this is time to retire from the sport, and just recently had that discussion with one of our athletes. Younger kids, you would think, younger folks would heal a little bit better, more quickly. In reality, we're finding that the younger the athlete is, the longer it requires for them to recover. Males tend to have a higher incidence, so it's more common in the male sports. Females tend to have more complications with post-concussion syndrome. And then repeated concussion and learning disabilities can affect folks' recovery from the concussion. So athlete much experience loss of consciousness or knocked out to have a concussion. That's a myth. You can have other symptoms other than being knocked out. So you don't have to be knocked out to define the concussion. And in fact, you can have a very severe head injury or concussion with including no loss of consciousness at all. Young athletes recover from a concussion as quickly as mature. We talked about that. No, that's not true. Actually, young athletes probably take a longer period of time to recover from the concussion than mature athletes. So that's a myth. Concussions result from a direct head trauma or injury. Said that at the top. It could be a head blow or it could be a body blow. When the body gets hit, the head follows, and that's sloshing around that we saw up here. The head is going to follow, the brain's going to slosh around, and you're going to get a trauma. So that's a myth as well. It is safe for an athlete with a concussion to return to a game when symptoms have resolved at rest. Heather's going to talk about a progression that we like to do to make sure that the athlete is going to do well when they get back into activities. So any child, any athlete that sustained a concussion, we recommend that they don't continue to participate. And we followed that guideline at Western as well. Anybody who's suspected of having a concussion, they're out, whether it's football, whether it's hockey, or whether it's cheerleading. Any athlete experiencing a concussion should not return to the same game. That is actually true. They probably should sit out, recover, make sure their symptoms are totally resolved before they go back. Sometimes you're not sure. I think that's where the medical profession can help you out and determine whether this truly is a concussion or not. But the stakes are so high, sending that athlete back, risk of a poor outcome is just not worth it. There are specific diagnostic tests that can be used to identify a concussion, and that's a myth. There's really no test. Now, you hear about athletes going to the hospital. They'll do CT scans, MRI scans. That tells you about the anatomy. That can show you if there's some bruising in the orange inside the skull. But it doesn't necessarily tell us about the functioning. So that may all look normal, and that individual still has a concussion. The anatomy is normal. There's not an appreciative amount of bruising, but there's enough microscopic nerve damage that it causes the symptoms of concussion. So once again, that's a myth. We don't have a good diagnostic test for this. We do some office testing. We look at their functioning, how they do number calculations, how they recall words, and that's how we usually make the diagnosis of a concussion in the office. And we usually take a good 20 to 30 minutes sitting down with each athlete and asking them some questions. So that's how we can help you here in the medical profession if there's a question whether this is a concussion or not. And with that, I think I'll pass it over to Heather and have her talk about what to do once you have a concussion, and then I'll be around at the end for questions.
Thank you, Mr. Baker. So as an athletic trainer, we deal kind of with concussions on both ends of the spectrum, typically both on the early onset, as soon as a kid receives a blow to the head and we maybe think that there's a concussion there, and then we work with individuals like Dr. Baker throughout the care of the athlete, and then as athletic trainers, we typically then help with the progression back to play on the opposite end as well. So we tend to be pretty well versed in what we would consider an ideal progression for the safest return to play. And so we're going to talk about the steps that we can take once you realize that one of your athletes does have a concussion, the proper way to go about the care and then progression back to play. First and foremost, Dr. Baker mentioned this, if there are any signs or symptoms, anything that sends up red flags in your head that there may even be a concussion, again, there's no way to absolutely have a black and white answer, yes or no, on the field if they do have a concussion. However, if you suspect a concussion, the first step that you need to take is removing that athlete from play or from participation. Ideally, they want to be evaluated right away by an appropriately trained healthcare professional. And what that means is somebody who has been well versed in all of the different tests that we use for actually trying to diagnose a concussion. The sooner that we can get to that athlete after the occurrence or after the hit or after the blow, the more accurate we can be in actually testing and actually listing all those symptoms. How many do they have? How long did they last? Things like that. So ideally, the sooner that they can get to a healthcare professional, like your family practice sports medicine doctor or an athletic trainer, the better off we are, because then we know where the symptoms started, and then we can watch the progression and the resolution from there. If in your case it's at practice, maybe mom and dad aren't there, they had to drop their kid off, go pick up some groceries, come back in an hour later when practice is done, you want to inform the parent or the guardian right away. They are the ones that are going to be monitoring the child as they go home, as they sleep at night, maybe monitoring their schoolwork the next day, things like that. So this is going to be a team effort in regards to care. In the athletic trainer, the physician, the coach, the parent, and even the athlete has some responsibility in their own care, and we'll talk about that. You can review the concussion fact sheet. This is something, it's called Heads Up for Concussion. There's a bunch of different concussion information sites out there. Sorry about that. The Heads Up Concussion is by the CDC specifically. Then Safe Kids, I'll provide you with that website at the end of the presentation, and you will be able to find all of our handouts. There's some wonderful full-color handouts that list the signs and the symptoms that Dr. Baker talked about that are a really great ready reference for the coaches to have too. So once we understand that yes, there is a concussion there, then we do have to talk about gradual return to play. Just recognizing the concussion and one day of rest and an extra nap after school isn't going to be enough. And we'll talk next about the proper way and the safest way for an athlete to go back to any type of participation, whether it be hockey, whether it be a contact sport or a non-contact sport. With this progression back to play, this has been something that has been researched and it's been adapted and it's been accepted by all of the high schools that we work with in our network in the area. Dr. Baker mentioned that they use this very same protocol even for their collegiate level athletes at Western. So this is something that has been research backed, and this is something that we are very safe in handing to all of our parents and all of our coaches, all the athletic trainers that we work with in our area in regards to returning athletes to play. The first step is no activity, and this is no activity until symptom-free. So every one of those symptoms that Dr. Baker listed, anything that the child starts out with has to be completely gone before they resume any type of activity. And this activity kind of runs the gamut. Yes, it's absolutely their practice and their sport that they participate in, but you also have to consider PE class in school during the week. You have to consider playing catch with brother and sister in the backyard at home, riding their bikes, things like that. We're finding more and more, too, that a lot of mental work has the same effect on a concussion as a lot of physical activity does. So extended reading, extended video game playing, or extended computer playing, things like that actually tend to, or can tend to make symptoms worse when you have a concussion. Just like if you were to go out and run with a concussion, a lot of times your headache will get worse or other symptoms will get worse again. And that is why we really, really, really strongly recommend that there's no activity until those symptoms are gone. A lot of times we're finding that sometimes teachers in the schools are having a little bit of a difficult time understanding this. Yeah, I understand Jimmy can't go to football practice because he's got a headache, but why can't he take his algebra test? Like Dr. Baker said, concentration is really difficult with a concussion. Memory is very difficult with a concussion. So you could see how even schoolwork would be very difficult to do in a situation like this. Once that athlete is symptom-free, no headache, no nausea, no sensitivity to light, they can focus and they can concentrate, nothing seems fuzzy or foggy to them, then they can start some really, really light, very basic aerobic activity. Now, one of your questions is probably going to be, well, how long does that take? All right. And as you notice, these are stages instead of days. We never put a number on a day or number of weeks or number of months for an athlete because it is so case specific. Each athlete is very different and will respond in a different way. More severe concussions will take a longer time to get through this progression. You have to let the body resolve on its own. You can't push this and you can't force it. You can't do anything or externally to make this process go faster. The brain has to heal itself on its own time. So light aerobic activity, maybe a light jog on a flat surface, maybe a little bit of a bike riding on a stationary bike where there's no chance you're going to hit a rock and fall off and hit your head again. Something that's very safe, very controlled, very light. The idea here being we want to start to elevate that heart rate a little bit, get the blood flowing a little bit, and make sure the symptoms don't return. A lot of times with a concussion, physical activity, increased heart rate, increased circulation will bring those symptoms back if the brain is not healed. So you may have Jimmy who had no headache for 24 hours, and he goes and rides his bike, and he comes back and he says, you know what, my head hurts again. That's very typical. If that happens, if any symptoms return along these stages, you stop and you start all the way back at stage 1 until they're symptom-free again. Stage 3, if you've gotten through stage 2 and Jimmy was able to ride his bike for 5 miles or Sally was able to jog around the block and you had no symptoms returned, no headache, no fogginess, no dizziness, no anything like that, then you can progress to stage 3. And it's a little bit more sports-specific exercise. We use the example of skating and puck handling in hockey, running and ball handling skills in soccer, specifically no heading or no contact in hockey, so no hitting or anything like that as well. Football quarterbacks, they can resume their throwing. They are not allowed to hit or anything like that. So again, no contact. This is a sports-specific drill with the idea of, again, increasing the heart rate a little bit more, moving them gradually towards full participation. Ideally in this step 2, you're adding a little bit of resistance exercises. If you have the luxury of having a gym or weight equipment or something like that, then some really low-level resistance exercises. If not, have Jimmy grab a can of soup out of the cabinet and start doing some bicep curls after he runs. Something like that along those lines. Again, if he remains symptom-free, then you can progress to stage 4. If any of those symptoms return, and this may be 4 or 5 or 6 or 7 days after the actual concussion, those symptoms can come back. It just depends on the individual. You're going all the way back to step 1 again. Stage 4. Athletes are allowed to resume non-contact training drills. So this is basically a full practice without contact. This is a normal practice without hitting anybody in the boards, without getting checked, without hitting in football, without heading in soccer, things like that. You can increase the intensity of the weights and the reps a little bit. You can do a little bit longer practice. Again, with the idea, it's a gradual baby step in increasing back to return to full participation or full contact and things like that. So, the big part in this step still is the fact that it is non-contact. All right. Our rule of thumb for any of our athletic trainers or any of our coaches that deal with concussed athletes, ideally they need to get through a normal practice, a normal full practice, symptom-free before they even hit the competition field or the competition ice or the court or whatever you want to call it. Full practice is the closest thing that you're going to get to a game-like situation. We never want to skip that step in between. So stage 5 is that next step, full contact practice, ideally after receiving medical clearance. For the Michigan High School State Athletic Association, the MHSAA, they have a rule in place that if an athlete suffers a concussion, they have to have a doctor's release. They cannot go back to practice or participation or competition without that physician's note. Outside the MHSAA, those rules don't always apply, but it is a very, very strong recommendation that your athlete see a physician once the concussion is sustained, and then a recheck for clearance after that. Okay? Especially when we're dealing with younger ones, you know, it's always good to have their pediatrician involved and have that concussion on their medical history. So if they can go through a full practice, normal practice, what you would put every other teammate through without having any symptoms return, the next step is return to full gameplay, full participation, and full contact. Okay? There are times where you will have athletes that may or may not have any symptoms all the way up to this point. You might get to stage 5 and their symptoms will return. It's one of those things that are touch and go. I don't see it very often at this stage, at this level, but it can happen. Again, the brain heals on its own time, so just be aware of that. And the final stage is return to gameplay. Okay? And obviously this is, again, when you've gone through all these steps completely and totally symptom-free. What happens when we skip these steps or skip over them or don't use them or allow an athlete to return if their brain isn't fully healed? It's something that we call second impact syndrome. This is basically when the athlete receives another blow to the body or another blow to the head before their brain has healed from the first occurrence or from the first injury. Okay? Basically, you're adding a bruise on top of a bruise in the brain. This is very, very serious and can actually cause some very life-threatening situations. You could have very severe bleeding in the brain, and a lot of times it's not something that you see right away with second impact syndrome. You don't see bleeding externally or anything like that. So unfortunately, you don't know it until it's almost too late. With second impact syndrome, if you've got that severe bleeding in the brain, it can lead to very permanent long-term issues, decreases in mental capacity. Second impact syndrome can create headaches, lifelong headaches or migraines. I know a number of athletes that have gone through their collegiate level career and are beyond it now, and they have headaches every single day because they didn't do the right thing in managing their concussion. And that's on the minor end too. We don't mean to scare you, we don't mean to be doom and gloom, but if we do have somebody who suffers second impact syndrome, the worst case scenario is death. And so we obviously want to avoid anything that falls within the second impact syndrome category. And that is why we really, really stress the importance of symptom-free along every single step before they return. So one of the messages here is communication. I think that's a really huge thing in dealing with any kind of concussion. It's communication between the athlete and the coach. A lot of times athletes are really scared to tell a coach about their symptoms, that something is wrong. Coach might bench me. I don't want to sit. It's a fear. And so I think it comes from the coach that it's a really important thing that, yes, as an athlete, you need to be absolutely honest with me, and I will do the right thing for you as your coach. So there's a communication in that aspect as well. Communication between the coach and the parent, what the parent's seeing at home during the day or in school that the coach needs to know about at night at practice. And then communication even with the teachers and the physicians and the athletic trainers that are involved as well. So it's really a joint effort. It's a community effort when an athlete suffers a concussion, if we really want that return to play to be successful. Dr. Baker, you ready for questions?
Sure.
So if you have any questions, please feel free. Go ahead.
Dr. Baker, should I have your ring?
The answer is no to that one. No way. I ain't giving that thing up. So.
Actually, I do have a couple of questions. What impact do mouth guards have on concussion prevention or deterrent?
That's an excellent question. I think there's some misinformation out there and overestimation of how much that prevents a concussion from occurring. There is some benefit if the blow should come from the bottom of the head. There is some shock absorbing from that mouthpiece, and that can help lessen the concussion. The real reason to wear the mouthpiece is to protect the teeth. So I don't discourage you from using a mouthpiece, but to get a false sense of security regarding concussion with the mouthpiece is probably not there. You should wear a mouthpiece to protect the teeth. First of all, it may help with a concussion. You still need to be concerned about that individual from all the other outside forces that can cause the concussion.
You earlier said that you don't like to put a time frame on the stages, but wouldn't it be fair to say that stage 1 would probably take about a week? Wouldn't a student should be away from about a week before they return?
You know, we used to grade these, more severe, less severe, based on a time period. And we've gotten away from that for the simple reason that everybody's an individual and they may heal or resolve in a period of time. Now, if you're talking about the vast majority of individuals, first concussion, first head injury, yeah, you're right. What we find is a majority of folks resolve Anywhere, some resolve as early as 3 days. And the question is, could a person like that start to progress back and be aggressive on that side? Certainly a possibility. I don't know that I'd recommend that. Anywhere up to 10 days when folks are fully recovered. So there's a wide window there, obviously. But in general, when we look across populations, you're right, it's about a week. So it does make sense with what we say in the past. But an interesting study was done where they looked at recurrent concussions, and when those recurrent concussions occur, 91% of them happen within the first 10 days. So as a physician, I feel comfortable when I get them to that 10-day mark that the risk goes way down in having a recurrent concussion. So I try to avoid giving you guidelines, first degree, it's a week, it's 10 days, things of that nature. Look at it individual, but if you want to give mom, child an indication, you're probably in the ballpark. Most take anywhere from a week to 10 days to recover.
From a strength and conditioning aspect, is there any way to help prevent concussions by neck workout, whatever, strengthening the muscles of the neck?
That certainly doesn't harm, and I would support an overall strengthening program to include the neck. To what extent that prevents those, I think the jury is still out on that, but it certainly isn't going to harm anything.
I think a lot of it as well in the prevention area of it is training technique more so, and the actual baseline skill for a lot of athletes instead of the speed and the power and things like that first. So
you're saying how to fall?
How to fall, yep. In regards to football, how to hit head. We always say head up, head up, head up. So your target, things like that. Is, so those skills and the proper way to make contact in sport, I think training those is going to be just as important.
Same thing, head up in hockey with checks into the board and stuff like that. So sometimes you're not prepared and you can't always do that, but you really risk a serious neck injury by having your head down is more of the concern. So. Yeah.
On Brian's question, these helmets you see, you got the basic helmets for kids and you got the ones that are double the price and they say they have all this concussion prevention. Any truth to that?
There's a lot of technology now they can put into helmets that will dissipate forces, but there's no helmet that's concussion proof or going to prevent every type of concussion. As we talked about it tonight, it could be a blow to the body and the helmet's not going to help you any there. There is testing that's done on helmets, and having the best helmet is a reasonable type thing to do. But to put somebody into an expensive helmet and think that they're treated for that, that's a myth too.
There was the comment on the knocked out. You have to be knocked out to get a concussion. Can you get knocked out and not have a concussion? Is that possible?
No. So if you get knocked out, yeah, you definitely have a concussion. The point that we try to get to is you can have a very serious head injury and not be knocked out. On the other hand, we've seen some individuals that get knocked out and they clearly have a concussion, but they sometimes heal or resolve as quickly as those individuals that have maybe 7, 8, 15 symptoms. So it's not the, in and of itself, predictor of the concussion, but it's another indicator. If you're knocked out, yeah, you probably had a concussion. But you still may resolve more quickly than this person over here that was never knocked out and had, 10 symptoms.
You were talking earlier about the activity level affecting a person that has a concussion. Does that do damage or does that just prolong it because you're using the brain and it doesn't heal as quickly? So if somebody's in a black room, let's say for a week, do they heal faster than somebody that's breathing?
What we're tending to see is a lot of times that the prolonged reading or prolonged computer games, things like that, can prolong symptoms, which just delays that progression.
It doesn't necessarily hurt the brain. It doesn't affect
We-
the concussion.
There's a lot we don't know.
Right.
I mean, there's some low-lying, low-level injuries that can cause this process of degeneration in the brain. A chronic traumatic encephalopathy is what that's called. That may not ever present as a head injury or concussion, but later in life seems to be affecting, as we see in the studies, these football players that have taken trauma over years and years. So it's somewhat, there's a lot we don't know about concussion. We don't necessarily know about recovery and stuff like that. But what it does tell us is if you're going back and you're having symptoms, likelihood is you're not fully recovered. And if you're not fully recovered and you're still participating, you're putting yourself at risk for that second impact syndrome, so a more serious injury. We can't look in the crystal ball and say this person's going to have second impact syndrome and this person isn't. There may be folks in the past, you all may have been there, I know I was. You had headaches, you participated, you went out and did it because that was acceptable. And a lot of us did well. We didn't have a problem or an issue. But looking back, we may have been very fortunate. So the message is the stakes are just so high when you're having symptoms, when that's an indicator that you're still recovering from the injury, just give yourself time to fully recover.
Is there anything you can do right after the injury to help it, like, with a heart attack, asthma or whatever? Is there anything with a concussion that if you know a kid's taking it, that you can do immediately that'll help getting in a dark room, removing from whatever?
The short answer is no. A lot of things have been looked into and tried. There was a time period where they really pushed creatine and stuff like that as a possible accelerator, and there's lots of nutrition type things and herbs that folks will, but there's no evidence behind any of those. It's the body's own time in recovering. And the more you allow that person to rest, so if they're doing too much, they're getting the symptoms, you're pushing them too much, then yeah, that's probably going to prolong the recovery. So you totally allow these symptoms to kind of drive what you do.
They still don't recommend Tylenol, correct?
Tylenol would be acceptable. It does not affect the blood in the sense that it doesn't thin out the blood. Things like ibuprofen, aspirin, naproxen or Aleve, those over-the-counter medications, those affect platelets. They can affect bleeding. So if there is a bleed, you're putting yourself at risk of taking those medications. So I usually tell folks, avoid those. Do take Tylenol or non-aspirin pain reliever when it's early on in the concussion, just on the outside chance that you might have a bleed there. So Tylenol is okay.
Because they used to tell you, well, when I got mine, they said, don't take it, it'll cause brain swelling. They've got away from
No evidence for that one. So Tylenol is considered safe in concussions. The others are a bit concerning because of bleeding and stuff like that.
Mm-hmm.
Sometimes folks will tell you not to take a pain reliever because it covers up the symptoms and then you don't know. Something like Tylenol is not going to do that. If people are going downhill, they're getting worse, they're going to be worse whether they take Tylenol or not.
How much time do you suggest after an athlete's been symptom-free to move on to the next stage?
Typically, if they're symptom-free for a full day, and athletes at this level, if they can get through a full day of school normally, and that headache doesn't come back with the screaming cafeteria and everything that would be considered a normal day, and they come back home and there's no headache the rest of the night when they're doing homework. So that 24-hour period of symptom-free, I would say is pretty safe the next morning to try that first next step, that light aerobic activity. Mm-hmm.
I would agree with that. And the simple concussion, this is the first concussion that they've had. They're following the normal course. It's resolved within a week, 10 days. When I see folks, I usually see the worst of the worst, and these are folks that are taking months to recover, and those are the individuals that will take those stages maybe a week at a time or several days at a time, depending on the situation. So to a certain extent, it's an individual type thing, but probably for most folks, first-time head injury, first concussion, following a normal course, like Heather says, it'll be each one of those stages will be a day. Yeah.
If you get a concussion, you heal properly, you get back in, the the next season you get another concussion, are they cumulative as far as the damage to the brain? And if so, at what point as a parent, coach, administrator do you say that kid is done?
Nobody knows the answer to that question. We have no way of predicting when the next concussion is going to be the big concussion. And individuals probably carry the damage with them. We're seeing that with the NFL studies. We still don't know the bottom line on that. Fortunately, most folks have enough, if you will, reserve brain power, cognition, that if you lose a little bit, you don't miss a whole lot. But we don't know in the long run whether, that leads to depression and other types of symptoms later in life. So it's a very difficult question when there's been multiple concussions. That's when definitely there should be a healthcare provider involved with that. Watching that, we can monitor some things over time, look at how they're functioning, even check them on a yearly basis and see, boy, your performance has gone down. This may be a good time to give it up. I had a discussion with one of the athletes in the office just the other day, had multiple concussions. Now at a point where the concussions are occurring with less trauma. We talked about that as a bad predictor. And they're taking a longer period of time to fully recover. And those are kind of ominous signs. We'll work up, look for any obvious trauma or damage that's occurred to make that decision. But many times those studies that we do are negative, and then it's kind of a judgment call. But those are some of the things in particular that we'll sit down with the families and discuss.
Now, piggybacking that, should, like for us in KOHA, should we be doing baseline testing? I've heard that for younger kids, it's not, you shouldn't do it for younger kids because their brain is still developing and their scores are all over the map anyway.
Mm-hmm.
Is there a certain age that from that point on and above you should do baseline testing?
The general rule of thumb, and I can tell you we do baseline testing at our office. There's a number of different products out there. It's an online computer test. It's called Impact. You may have heard of that. There's other ones that are similar. Headminders, Cogsport, are different types of programs that kids can sit down and do a baseline test with the idea that they get head injured. You can come back, compare, and you know whether they're different from their baseline. If you look at how that's marketed, and it's a business, they market those things. It may be good, it may not. It helps us some. We look at everything when we look at an athlete. We use it at Western. We use it in a couple of high schools in town. But if you look at how that's marketed, it's high school and college. Anybody below that, they really don't market it to, if you will. So, there's such variability, as you point out there. There's something called plasticity. So there's this developing brain that you can't sort of account for. So it makes those brief cognitive testing devices less beneficial in the younger group. So I would say anybody below the age of high school, I'd question whether it's worthwhile to do that baseline testing. Having said that, I also think that that's probably the group that's at the greatest risk and is going to take the longest to recover. So playing it even safer with that group as opposed to your high school, college level. Other questions?
How do boxers survive?
I guess what's their functional level? Survival is kind of the big. Survival is by definition bare minimum. So I don't know.
There's been stories in boxers, and there was a time where they did lots of investigation. Same thing that they're doing now in football. I mean, you're pretty much seeing the same thing that occurred here. And there are folks that are probably genetically predisposed to this. We were set up to do a study with our football players to look at genetic testing and kids that get head injuries and stuff like that. So there's probably some, we just don't know the bottom line of that, but there's some genetic makeups that make folks more predisposed. So that's one thing. The other is boxing has some checks and balances, and whether they get enforced or not, but to kind of protect folks from these. But I don't think that it's out in the open probably in boxing. We probably don't know the bottom line.
Do you think more concussions are occurring now, or do you think you're just catching it?
I think we're hopefully getting better at identifying them. If you're asking me, is that a good thing or a bad thing? I don't know, but hopefully it'll lead to more information and better skills at dealing with something like this. So, but on the other hand, when you look at what's happening with those players in the NFL and the changes that they're seeing in the brains themselves, I mean, it's a risk, and it's pretty scary. So there's folks out there that are doing research in this area and would say, I'd never let my son or daughter play football, soccer, what have you.
Do they think that's drug-related as much as it is concussion-related?
Well, you know, I bring up that point too. I mean, we have our athletes at Western that go out and play football, and yeah, they probably get some brain damage when they play there that never gets picked up. They don't say anything about it. They fly under the radar. How much is that related to what they do on the field compared to going to Waldo's on Friday night or drinking a keg or something like
Steroids or
that?
something like that?
Steroids is the other thing. So.
It just seems that a lot of the cyclists that were using certain types of drugs end up with different types of diseases that are all neurological based, lupus, things like that. So I know in cycling they have this correlation where it's odd that the cyclists seem to get this, neurological problem, and all of them also took, specific types of enhancement drugs. So that's why I ordered it.
Yeah. Some of that you have to kind of take with a grain of salt. The same thing with what's going on in football, where you're seeing these individuals with depression later in life and committing suicide, and then they look at their brains and they're dead. But there's a lot of folks, whether or not they played football, that have the same issues. They have depression and stuff like that. So, you find these things, but how much is that some underlying issue like you bring up? So hopefully over the years, gathering more data and stuff like that, getting this out in the open, we'll have an appreciation for what extent, what you're born with, whether you have, family history of depression or something like that, and whether that adds up later in life, whether playing, sports and getting concussions makes that worse or it doesn't. Hopefully we can answer those questions.
Did you catch that there was a website that you go to?
It
Nope.
may have.
You didn't take note of that if I want to, because there's some
Yeah.
good pieces on that. If Heather can get back to that.
There we go.
There.
Oh my goodness. It doesn't like.
Presentation.
SafeKidsKalamazoo.org. And they do have a sports information tab, and then all the concussion information is there. And actually, the steps of return to play that we just talked about, there is a full color 8.5 by 11 handout on that you can print out, as well as lists of the signs and symptoms. So it's very user friendly and easy access for all that information.
So my son gets a concussion. You mentioned the pediatrician, making sure they were on board, but does it make more sense to bring him here as a pediatrician? How much are the pediatricians on board with all this in general, or is it better to see somebody who's really...
That's one of the challenges, and there is a concussion law in the state of Michigan. There's concussion laws across the United States. I think there's about 40 states now that have concussion laws. And one of the challenges is to define who the person is that's that healthcare professional that can make that decision. The bottom line is I'm not sure that, I can tell you one way or another. I'm sure there's some primary care doctors out there that do a really good job with this. It's not necessarily part of their training. It's not like, you sprain an ankle and you go to an orthopedist, and if you have a problem with your teeth, you go to a dentist. It's not an area that's defined by one profession or not, so there's a lot of overlap there. I think starting out with your primary care doctor is a reasonable type thing to do. There's a lot more awareness now. And then we tend to see the sort of the worst individuals, but, you know, we'll help anybody out with that, so. So start with your primary care doctor, and I think most primary care doctors really, you know, understand, and if they're not comfortable with it, are not going to just say, go out and play, so.
Okay, any more questions? One more? No? Great, thanks again for coming.
Thank
you.
you.